So welcome everyone to Tuesday night. You all know it's my favorite night because I have my 15-minute business spotlight, and I always invite people that help people flourish. And you know that my special place in my heart is for kids. You know, it's for families and helping families work better, because when you have strong families, you raise strong kids. So tonight I have, it's kind of like a family because I've known his mom for a while. We're business colleagues. And now he's all grown up and he has his own practice. And this is Bryan Epel. He's a licensed clinical social worker, correct? And
Correct.
he's going to talk to you about his very innovative, great for the times practice. And I'm excited about it because it's all about helping kids, teenagers flourish. So I want Bryan to talk a little bit about how he got started. What's your passion? What is your practice about? What's your main aim?
So thank you. First of all, Belinda, thank you so much for having me. I was really excited. I've been waiting, chomping at the bits for this day to come. So first of all, it's called Be Your Best Therapy. So if you were to go beyourbesttherapy.com, you would find me. And so part of the reason I called it Be Your Best Therapy is because I want people to be the best person they could possibly be. Right. And I think that everybody needs a little support here and then. I just recently started the telemental health private practice. Telemental health is I do all the services via the computer, which I think is perfect for the times now. And so, but I started formulating this idea in 2019. I have over 20 years experience. So I've run a mental health clinic. I run a chemical dependency program. I've worked in a high school. I've done case management for older adults. That just kind of scratches the surface. So I've worked in the field for over 20 years, which is kind of scary to think about that it's been over 20 years. But I always thought that, when people feel safe and secure, that is when the best work takes place. And so to me, where's the safest place you could possibly be? In your home, right? If you feel safe at home, then you're more willing to talk and you feel a lot more secure about what's going on. Although my official address is in Bayside, like I said, I do everything telemental health, so I can see anybody from anywhere at any time. So you could be, on vacation, you want to have a therapy session, you can do that and not have to leave your house or leave Hawaii or where, wherever it is that you're going to. And for me, really the mission more than anything else is that, people go through challenging situations in life. And even though you've been very successful navigating through a lot of them, every once in a while we need that extra support. And asking for help is a strength. It's not a weakness. And I find that the stigma that people had about getting help or seeing a therapist, has changed a great deal. We're in 2020, and I feel like it's more of the mainstream. Just like your physical health, your mental health is just as important as anything else. And everybody needs a helping hand, whether it be an adolescent, whether it be an adult. And in the therapy, we go as fast and as slow as you want because you're the boss. You dictate the terms to me. Um, so I mean, I hope that answers your questions. I mean, in the way I intervene, in the way I do my therapy is based on the uniqueness of every individual.
Right. So yeah, I mean, I agree with you, and I have to be honest. I was, not, you know, it especially in this world today with the social media and everything. I have to be honest. I wasn't even with my own kids. Wasn't even didn't even realize till I delved deeper into it how the whole social media thing has completely made mental health even more of a priority, because a lot of comparing, a lot of things that happen when you're so addicted to social media and how your mind works. I mean, I think I heard, I can't take credit for this, but I really loved it. You know, when you're sick, when you have a cold, when you have migraines, where do you go? You go to a doctor to help fix it. There's no stigma in that. But when your mind is, you need help to reset your mind, or you need help with your car, you bring it to a mechanic, you need help with your mind, you go to a licensed, certified mental health care provider. And there is should be no stigma in that. If you need it and it works for you, that's what you need, right? And I think, like, with especially that age group that you work with, it's important because I don't think they do feel safe in other places, maybe not even in their own family, not safe, harm safe, but a safe space to talk, which is
Correct.
why I
And
was so compelled to have you on this tonight, because it's a way for people to reach out to somebody. So before we were on live, you had said something that really struck me about how you are a tool for for the parents to help with their children. Can you tell us a little
right.
bit about that?
Yeah, sure. So, I'm not one to question a parent's ability to parent. I mean, these are your children, and so you're the experts when it comes to them. However, my goal is to add more tools to your toolbox. The idea of a therapy is that I can take an objective look at what's going on with an individual. And what happens is parents and children, they're so emotionally attached to one another. Sometimes it's hard to see what's the expression, the trees to the forest, or whatever that expression is. Sometimes it's hard to take a step back and look. So really, my goal is to get more insight into someone's child and to help the parent maybe or the guardian to see things maybe in a different perspective. What works, what doesn't work. But something I also said to you, and I always give this example is, I've been doing this for over 20 years, and I worked with lots and lots of parents. And what I find that sometimes parents or guardians, they try to have these battles with their children on so many different topics. Clean your room, keep your hair neat, do this, do this, do that. And what happens is that it's like a war of attrition almost. And what happens is that you're going to get so worn out with all these battles that you're going to lose. And I hate to put it in this analogy, but you're going to lose the war. And the example I always give is I used to have I know it's hard to believe, but I used to have very, very long hair. And my mom's friends would always say to her, "You allow him to have long hair?" And my mother would say to them, "Listen, he showers, he keeps it clean, he keeps it trimmed, it makes him happy. There's other issues that I have to worry about when it comes to him. I don't have time to battle him when it comes to his hair." So I give that example as a way of kind of an intro into how I kind of work with adolescents and parents. It's my job is to understand the adolescent, the teen better as much as I possibly can, and to help the parent guardian to get insight into their children. Because another example is my sister and I, we both have the same mother, clearly, but we have two different personalities, and so she wouldn't treat us exactly the same because we have different personalities. And sometimes parents have a one size fits all kind of plan when in fact it's each child is a unique individual and it's learning about their uniqueness. I think it's important that parents are involved in the treatment. Sometimes I get parents who are like, "Well, here's my kid, fix them." But whatever's going on with your child is part of the family structure. You can't remove the child from the family or the family from the child. So the idea is that I work closely with parents. So we work on treatment together. What the treatment's going to be, and it has to be a treatment that the adolescent and the parent are agreeing upon. There's a compromise of what the treatment is going to be. And so, my expertise has always been teens and adults. I still feel like a teen. I still feel like and I don't talk in a very therapeutic manner. I don't use very therapeutic words. I think I connect with adolescents because I talk their language and I just kind of keep it real. And I don't seem like that professional therapist. I'm just this person that they're having a conversation with. And each child's different. It takes time for them to engage with me, get to know me. And something I said to Belinda was, and I'm not saying I'm the best fit for every single child or young adult or adult out there. Part of my strength is understanding where my strength is and where my weaknesses are. And so the idea is that, I give everyone a free consultation. It says a 15-minute consultation, but if you want to talk for 45 minutes, I'm more than happy to talk for 45 minutes and to make sure. You might say, I think you would work well with my child, but I might say, well, I don't know if I'm an appropriate therapist for the issues that you're stating to me. So if I say yes, I feel confident that I can help. And so, like I said, adolescents and adults is kind of where I thrive. I work, depression, anxiety, trauma, defiant behavior, grief, trauma. It seems like more and more now at the 21st century, trauma is a bigger
Mm,
issue than it was many, many years ago. So I'm certified in TFCBT, which means trauma focused cognitive behavioral therapy. It's a
wow.
type of intervention to help those who have trauma. But my interventions differ depending on the individual I'm working with. I don't have a one size fits all because it can't. Everybody is unique and I have to fit according to the uniqueness of that individual. Um, I kind of, and the two things I don't work with is children who are autistic or individuals who are autistic and eating disorders. That is not where my expertise is. And eating disorders requires a lot of working with medical doctors and things of that nature. And autism is a very specific, you need a specialty in therapy to work with children who are autistic. So I just kind of wanted to put that out there.
Sure. So I know. So we'll just focus on the trauma, because I think that
Sure.
initially when people hear about trauma, they think, "Oh, I didn't beat my child," or that nothing happened to my child, that they were like hit or abused or some kind of injury. But can you tell us exactly? Well, I know it can't be exactly because trauma is different for every person, but a
Right.
visceral response, right, to an event that may not have been something that anybody saw. Am I correct, or am I incorrect?
No, no, you're absolutely correct, Linda. I mean, trauma can happen at any time. Sometimes, an event happens and it seems like no big deal to a lot of people, but for one or two people, that event can have a great deal of impact. How we react to just external stimuli is different for every individual. So, three people could be like, "Oh, that was no big deal," and the fourth person can be like, "Oh my God, that's a huge deal." And so everybody reacts differently. So trauma is not necessarily, physical abuse, sexual abuse. I mean, if you record an earthquake, I mean, that's trauma. There's also, witnessing domestic violence within the household or overhearing it or just being aware that it's going on. Another type of, like, secondary trauma. It's like when you're hearing other people talk about their trauma and you hear enough people talk about it, then you become traumatized hearing
Right,
about, the
right.
trauma. That's why as a professional, I've learned the skills to be able to make sure that I don't internalize the
Internalized.
trauma of what
Yeah.
I'm hearing. So trauma comes in many different forms. And if people aren't sure, like, is my child traumatized? That's why I do a full assessment, because there are certain symptoms that people look for that are specific to those who have been traumatized.
Right,
And
right.
so, I make sure to assess and ask the questions to funnel it and to narrow it down to the point where, okay, I can fairly, with fair certainty that this is trauma.
Right, right.
And so there's a specific technique for that, when it comes to trauma. But I find that some people don't want to talk about their past issues. They want to talk about, how do I solve my present issues? So I'm not one to say we have to go back to when you're 4 or 5 years old. Some people don't want to do that, and that's fine. We can talk about present issues. But I do believe that's what happens in the past
Right.
influences the present, which then therefore influences the future. But like I said before, the approach I take is different for everybody and what they feel comfortable with. If somebody
Sure.
doesn't feel comfortable in a certain line of questioning or a certain type of treatment, we won't do it.
Right.
Well, and my job is to come up with a different, intervention, a different technique.
Right, right, sure. I mean, I always think, again, before I would be like, well, what do you mean trauma? Is that a little over dramatic? Well, trauma could be as simple as, yeah, I had this time where I had to pull over in the car to have a conversation. It wasn't anything traumatic, but you know what? For years, every time I drove by that area where I pulled over in that parking lot, I feel like, ooh, and then it wasn't until it occurred to me, like, yeah, that was kind of a little mini trauma there, because this conversation
Right.
that this person had with me was very jarring and jolting. And, it took me a while to be like, okay, I'm okay with it. But again, I wasn't hit. I wasn't for verbally abused. It just was a little
Jarring.
traumatizing,
It
jarring.
kind of
Yeah.
jarred you. And the thing about working with people who have been traumatized is,
Yes.
you don't talk about the trauma right away.
Yes.
Because
Okay.
then if the person relives it, they don't have the skills to deal with it. The idea is to first educate, then to teach certain skills, and then eventually go through what I call the narrative, telling your story, writing it down as if it's a book. It could be one chapter, two chapters, whatever, but it's talking about your trauma. But when you talk about it, you are prepared to talk about it because you've been educated and you have the skills to cope with the feelings that will come with the trauma. A lot of times therapists make the mistake of like, let's just talk about the trauma. And when studies have shown over and over again that TFCBT is a very effective tool in working with those who have been traumatized. But there are other effective tools as well. That just happens to be one.
Wow. Well, I feel like we need to have you on again because that's another interesting concept and seeing ways on how parents might be able to, you know, like kind of look for any signs that maybe their child needs help that they didn't realize.
Right.
So,
And
yeah.
I could work with someone and be like, ask the questions. These are the signs that, have you seen this sign? Have you seen this symptom? But also more than anything else is I'm working with a teen who have been traumatized. The parent is also involved. The parent's being educated. The parent is also learning the same skills. Because the idea is that if your child is having an issue, you need to know the skills that they're taught. So you can say to them, don't you remember, Bryan, the therapist, he taught you this technique? Let's do it together.
Mm-hmm. Mm-hmm.
So it's a way to bond with your child and let the
Wow.
child and let your teen know that I'm here to support you. But we can also do this with adults as well. You don't need to have a parent involved for this to be an effective treatment.
Wonderful. So, all of you that are watching, if you have any questions, you could just type them in the comment box there, and I'll ask Bryan. But while we're waiting for any questions, Bryan, is there anything else that we hadn't gone over that you would want the audience to know, either live or on replay? And we will
Oh
be
yeah,
putting
sure.
in.
I am Spanish speaking. Yo hablo español, so alguien quiere terapia en español, yo puedo hacer eso. My parents are from Argentina, so for me to speak to my family, I have to be able to speak in Spanish. So I am bilingual in that regard. Um, and I think, I mean, I could talk forever, literally forever about this, of how I work with young adults, how I work with adults, how I work with teens, the interventions I use. Like an example, depression in a teenager looks differently than a depression in an adult. You might be saying, why is my child so angry? They're angry because they're depressed. It's just that depression comes out as anger. So it's a lot of education has to take place to know how to speak anxiety speak, or
Mhm.
depression speak, or trauma speak. To be like, sometimes parents will say to me, I don't understand why my child would say that. And it takes me a while to kind of explain this is why they're probably saying this and thinking this way. And the parents sometimes say to me, it would never ever occur to me to think that way. I don't even,
Mhm.
it doesn't, it's like, to me, it's a foreign concept, the way my child is thinking.
Right.
But the idea is learning a new language.
Right.
And so I think that's also very important to know. But like I said, I could
Wonderful.
talk,
Yeah.
talk forever. And
Yeah. Well,
by all
we will have
means,
you on again.
okay, please, ask as many questions as you want. I'm here to answer all your questions. If you're just kind of curious, like what is therapy or how does therapy work? It could be a general thing, such as what I tell people about therapy, and this is going to sound very odd. It's not the job of the therapist to make you feel better. And people are going to say, what are you talking about? Then, like, aren't you like a doctor? You give me an injection, I feel better. The idea is that the therapist is going to help you so you can make yourself feel better. The idea is that we don't want to depend on someone else to make us feel better for the rest of our lives. The idea is to give you the skill set so you can go ahead on your own without someone by your side.
Right.
So that's something I think is important that people understand. And therapy is about the questions sometimes, not always the answers. Sometimes I'll ask a question that gets your mind thinking in a way because you're like, I've never been asked that question before. And it gets your mind thinking
Right.
in a different kind of way. Or planting, I use the analogy, it's like planting seeds. And eventually over time, the garden grows. These ideas flourish. And the idea is I want the ideas to come from the individual. A lot of times therapists, I feel like all they do is give advice, do this, do this, do this. But we all know from our experiences that if it's our idea, we're going to put 100% effort into it. But if it's someone else's idea, you might, excuse the language, kind of half-ass it. And
Mhm.
then when it doesn't work, you go back to the person and be like, that was horrible advice.
Mhm.
Like,
Right.
my job is not to be like, do this, do this, do this. It's to help the individual come to the realization, oh, I should be doing this. I should be trying this. So,
Well, that's great. And like I said, love to have you back on at some point again to maybe, give us a little top 10 tips or something.
oh
We
yeah,
can
yeah,
talk more about
absolutely. Just one other thing is that, I'm working right now on being on some insurance panels. So, currently I do things through, Google Pay, Apple Pay, Venmo, things of that nature.
it.
And I think that my rates compared to what I've been seeing, competitors are a lot lower. I know that, parents are willing to pay almost anything when it comes to their child's mental health. But I'm a social worker at heart. I want to help those, and I want to help them within a reasonable,
Mhm.
rate and reasonable time and reasonable everything. I was a born social worker, so I just want to
Yeah.
help people. I don't want them to pay an arm and a leg to help their child, you
Well,
know.
that's wonderful. That's wonderful. And I will post your website in the comments as well as on a post. And again, I just thank you for being on. And hopefully we will see you soon. Um, and say hi to your mom for me.
Oh yeah, no, I absolutely will. And I learned a lot from her. It's when I do therapy. When I became a therapist, I thought a lot about what my mom did with me and some of the issues I went through. And so it helps me connect. And I think that, I'm not going to tell my whole personal story, but I had some issues growing up. And I feel like those who have gone through those issues are better suited to help others who have gone through issues,
Right.
because you can
Sure.
use some empathy and really try to understand,
Sure. Yeah.
why are you thinking this way? Parents are concerned about cutting behavior,
Mm-hmm.
things of that nature. What does it mean? My child's cutting. Does that mean they're going to kill themselves? I mean, there's a lot of
Right.
worries that parents have, and I know they have thousands of questions about, like, what do I do? What do I do? So, like I said, if you guys want a free consultation, just give me a call. We can talk for an hour. We can talk for 30 minutes, whatever it is. And, to make you feel comfortable and make you feel secure that, I'm the right person to help either you or, your teenager.
Great. Thank you so much, Brian.
No,
And
thank you. I appreciate it.
well, you're welcome, and we appreciate you being on. We appreciate everybody watching. So thank you for flourishing with me tonight, Dr. B, and we'll see you again next Tuesday night with our 15-minute business spotlight. Bye, everyone. Thank you.
Bye.